Hey, good afternoon, everybody. My name's Jay Mervis. I'm the Senior Director of Healthcare Sales at Fortinet. Thanks for coming out today to our Fireside chat about medical device security and embedding it. Just so you know, in the front few seats here, there were some hidden envelopes with cash underneath, and I'm sorry you missed out on that. But I'm here today with Troy Ament, our field CISO. Troy, you want to give yourself an introduction?
Yeah, thanks everyone for attending. So I'm Troy Ament, field CISO at Fortinet. Been on the customer side for just over 20 years. My previous roles, I was a regional CIO for two large major health systems, and then about the past decade, a CISO in that space, overseeing all kinds of digital transformation and security operations. So I appreciate everybody being here.
Yeah, thanks for coming out. So Troy, let's talk about some of your experiences. Can you talk to the group about the evolution of digital transformation across the healthcare ecosystem and what that's meant to improving patient safety and streamlining operations?
Yeah, I think one thing that's really exciting about healthcare that all of us that are, I think most of the room or everyone that's within healthcare doesn't realize is healthcare drives the highest value. So 20% of more investment than other industries in investing into IOMT, right? So I think the reason for that is there's been a lot of value, whether it's radiologists utilizing PACS workstations, mobile apps now hosted in the cloud and using wireless, or that's other workflows within the environment, right? So you're seeing the adoption the past decade of electronic medical records and organizations getting better and better about using those, and now moving that into AI and machine learning of, whether that's within research or radiology. But to that end, I think during my career, when we would implement, connected medical devices before, maybe we had kind of going back to 2010, we weren't really worried about cybersecurity as much as what we are today, just because of the advancing threats. But what I saw during those implementations, kind of going back that far, was, nurses being able to be with their patients more because they're able to, automate results from vitals machines and that type of thing from patient rooms. And that's some of the same things that we're seeing within the radiology space, right? Just better patient care and better results, better patient safety from that perspective.
Awesome. Thanks, Troy. So as we've seen feedback from customers, the threat landscape continues to evolve along with a growing attack surface with the new IOMT innovations. How are you seeing healthcare organizations affected by ransomware threats from an operations and patient care perspective?
Yeah, so there's a lot of challenges, when you look at ransomware attacks that are affecting health systems today. I think we'll have a couple slides and visuals for everyone, but some of these are some of the challenges as we outline them. But what I see, kind of going back to my days of overseeing a health system in technology and security was, a 6 to 8 hour downtime was something that was very detrimental to a health system previously. And what we're seeing now is those previous extreme downtimes of 6 to 8 hours, whether it was a PACS system or EMR, that's the average right now is 1 to 4 weeks, right? So if you're a radiologist in an environment and you have a ransomware attack, imagine yourself not being able to access your PACS system for well over a week, having to go right directly to the modality for, critical ER cases. And in a lot of scenarios, organizations just go into an emergency management type situation, and they're doing patient diversion even from their ERs, canceling a lot of elective procedures. And then as we've seen, really the evolving threats happen, the attackers are getting better and better, know more and more about our environments. So we're seeing more niche cases of attacks. I think we'll talk a little bit more about that. Some things that come further down the line though. So as we, make recommendations to executives, that sit around the boardroom table, planning for 1 to 4 weeks or even more. And, what are some of those things? Those things can be things like, having enough supplies, your ERP system being down, your supply chain system being down for a number of weeks and not being able to order supplies when you're out of supplies. Other things, getting past 2 weeks, a lot of organizations aren't able to process payroll accurately. So they're having to go back to maybe old records, making some assumptions, putting in very manual processes to process payroll. and coming up with really creative ways to do and manage radiology, laboratory, and pharmacy as well. So that's what we're seeing. Definitely organizations that used to have DR plans and incident response plans that were maybe for a week or two definitely need to be putting things in place that cover maybe a month or two, which is extreme, but it's happening every week. We see this across the industry.
Well, great perspective, Troy. So cloud-based SaaS clinical applications have been particularly targeted by threat actors. Troy, can you talk about that dynamic and how that's changed?
Yeah, and where that goes is the adversaries always want to, because if we look at like this slide here, the adversaries, when you see this big incline here over the course of 20 years, why was there a big increase in threat? Well, it's because the adversaries were able to monetize the threat, so they're able to come up with creative ways to leverage an organization to pay ransomware anywhere between 1 million and 100 million and thousands of dollars, right? As we kind of talk about that, we have to really think about the adversaries are looking for opportunity, right? So they're going to look for a SaaS-based solution that maybe hosts 100, 200 different health systems, right? Because if they can go after a partner that maybe is hosting a PAC solution, a radiology solution, workflow solution in the cloud, and that solution isn't secured appropriately, they're going to affect many more customers than they would if they just went after each individual hospital that's running that same independent platform. So that's what we're seeing. We're seeing a lot more investment from SaaS-based providers, whether it's HR systems, radiology providers, but need to go much deeper. And I think as a health system, if you're an organization, if you're someone from an organization such as a health system in the room, what you really need to do is be doubling down on your third-party risk assessments. Don't make assumptions that just another organization is handling security on your behalf and protecting you on your behalf, because unfortunately, there's those organizations might not be doing that or have your best interests in mind. So I think making sure they're very mature within their cybersecurity program, and then making sure they have things like DR practices in place. One thing that we've seen as it relates to SaaS-based providers is they may have a ransomware attack, they may have the ability to restore, but in some scenarios, each one of their environments is really a separate environment for each customer. So when they have a ransomware attack, it may take them weeks or months to restore your environment, because they're having to restore each environment singularly across their technology stack. So I think asking that question, like, where am I at in the chain? How do you do restores? What would it look like if your environment was impacted? Including them in your incident response and your governance program as well, so that you understand, really who your top tier SaaS providers are and how they can impact your organization, and rising that up when you're making those purchase decisions.
Awesome, Troy. So as a former CISO of an integrated health system, what were the key differentiators that leading medical device manufacturers are doing to partner with CISOs in those organizations?
Yeah, so 8 years ago when we started talking about this, I was on a really an advocacy group in Capitol Hill, and at that time it was kind of the stone ages of medical device security, and we started to have ransomware and malware, and we started to become concerned about these challenges. And at first, we just got done implementing Epic and doing a lot of device integration, and obviously we had automated PACs and digital PACs, and then we went back to the medical device manufacturers and said, hey, well, what about security? Because we're having some concerns here. And initially it was kind of hands up, very nervous, not a lot of transparency, but if that's all changed, right? So we're headed in the right direction. We're at the, I would say at the beginning of the journey, but I think there's a lot of partnerships. So what I would look for today are really transparency, having that organization being willing to do a third-party risk assessment, being transparent about their operations, making sure that they're partnering with security leaders in the market, trying to recreate the wheel. There's so much cybersecurity technology out there today. There's really no need for, maybe an independent medical device manufacturer to be building some of this on their own, because they just don't have do not typically have the expertise. So I think that's important as well. As I look at, kind of the industry, as I see it, and I talk to my peers, what I hear is there needs to be a cybersecurity advocate and leadership within the product security team. We see that, just some examples, Roche, Baxter, Siemens as well. We see a lot of great investment there. So they've got advocates, really working with us on Capitol Hill. We'll talk about the Patch Act a little bit later, but forming some of that legislation, working with the FDA to make sure that the guidelines that we're putting in place make sense both for medical device manufacturers, make sure it's something actionable they can do on their side, but then something that's also provides value for providers in the provider space as well. I would say that the other thing that I would lean on from, what we look for as a CISO is making sure that they're deeply invested. As they're coming out with new products, if you're buying an existing product that already has FDA approval, what are they doing for their new products, right? Because I think you'll begin to see what is the future of that company going to look like, because I think in 5 years, the expectation is that any new products that come to market are going to be have a cybersecurity life cycle from an FDA from a device perspective. There'll be things we'll talk about, software bill of materials, all of those types of things.
Awesome. Thanks, Troy. We're going to talk about the Patch Act now. So can you talk about the Patch Act in detail, like its history and where you think we're going to evolve from a regulatory perspective? We've had a ton of conversation about this and watching this market closely. And like you said, you've been deeply involved for a while.
Yeah. So I would say 7 years ago, like I said, a group of us started to work with the FDA, really a collaborative group of the FDA, medical device manufacturers, even payers and providers to the table, so that everyone had a voice. So we had some development. It was bipartisan legislation at Capitol Hill for the Patch Act come out this year. So I think it's a great start. It isn't something that's been written into law or approved or anything like that yet, but I think it's a great start. I think we need a little bit more detail in there. It needs to be probably a little bit cast a little bit wider net. But some of the things that we're seeing in there are a cybersecurity life cycle, and that's really the gap that we see in connected medical devices today. And it's of no fault of their own. That's they were built to be safe for our patients, and that's what we have in mind at all times, is patient safety. But I think as the FDA looks at it now, and all these devices are connected to the network, they realize that cybersecurity is an important component of patient safety. I sat on a panel a few weeks ago, and we had an engineering company reverse engineer a vitals machine, and really all they did is they went and bought an off-the-shelf vitals machine. They opened up the case, they looked at the motherboard, reverse engineered the firmware, and they were able to find an exploit and build an exploit. They were able to put it on an iPhone. Some of the things that they were able to do with that was put ransomware right on the device. So just totally toast the machine, make it unavailable, which would be very, very difficult, obviously, for organizations to recover from. Another thing they were able to do, though, as well, is right live in front of the audience, they were able to change the vitals of a patient sitting there up and down. And that's something that just a couple engineers, they took a device, they tore it apart, looked at the firmware, reverse engineered the code, and built an app that built an exploit and was able to change that. So some of these things are real. Some of them are very challenging to do, though, as well. So it's going to take a threat actor, a nation state, someone like that that's very interested and motivated to do something like that. But that's as I talk about like SaaS-based applications. It doesn't take a lot of motivation if someone knows that, okay, 1,000 health systems are running this app. It might be poorly protected. They're going to go start scanning those SaaS-based applications and try to attack those versus single hospitals, because they can cast a wider net. What I can tell you, because this has happened, is when a SaaS-based application has a ransomware attack and becomes unavailable to its customers, and you've got 1,000 health systems calling you saying, why should I pay you? Why should I continue to invest in your company, a lot of times they pay the ransom very quickly just to get their customer base, because that's the heart and soul of that company.
Wow. On the same thread, Troy, do you see regulation, competition, or both? There are going to be keys to success driving this in the ecosystem, the Internet of Medical Things.
Yeah, so I don't ever think that the final regulation or law necessarily drives cybersecurity, right? But I think it's a combination, right? I think it's individuals that help build that, legislation, law, requirements, whatever it might be. And when it's done that way and it's a collaborative group, I think there's agreement it's the right thing to do. So I think once everyone agrees it's the right thing to do. But the one thing I'll mention there is competition is significant. So in what we're now seeing within medical device IOMT security is a deep investment by the big players, right? So they're investing significantly in their cybersecurity programs. I was a customer of one organization in the lab space. They had thousands of customers, over 40,000 connected medical devices across the globe, and they invested in firewall technology for every one of those sites. So that meant for them, these are existing customers. They invested in 40,000 firewalls, really across their customer base. But the goal of that initially was yes, security, but the initial goal was to improve their service offering. So their field services teams, they're spending a lot of time on the road, flights, that type of thing, to service laboratory equipment, and they needed a better way to access those to reduce that cost. Secondly, they needed a better way that was a consistent and recognized standard from a remote access perspective, because as a CISO, the first thing I would ask when we do a risk assessment is, do you need remote access to my environment? That was something that we held very closely, because anytime we opened up the door to someone in our environment, it represented risk. So they did that. And then third, what they did is they turned on things like access control lists. So custom access control lists, IPS, right embedded in the chassis of their device. So think of a lab system, PAC system, that type of thing. And what's happened, so they've done this project. Ransomware has been really prevalent in the last 24 to 30 months within healthcare, and they have yet to have one of their devices that has Windows devices sitting behind it impacted by a ransomware attack. So that's become a business differentiator for them. They've had environments where they've had their brand at one hospital within a health system, and their competitor was in a different market down the street, right? And the organization switched that device when it was up for renewal to this one, because they were saved during a ransomware attack. So I think competition from that scenario is a great example where people are building this, and I think a combination of the regulation, it being really bipartisan, joint effort, everybody's best interest in mind, and then make it competitive.
Yeah, I love the competition story, Troy, and I love the operational efficiency, because everybody's trying to drive, because the resource constraints have been just enormous everywhere in the business lately. So let's stay on the same thread. Software building materials, or the SBOM, very critical component, has been incorporated, discussed at length by CISOs and the medical device manufacturing community. What are you hearing from the industry experts that you deal with?
Yeah, so I'm hearing everything and everything in between. There's people that are really passionate, both on the medical device manufacturer side, and then if you're a consumer of these goods, this technology, on the provider side too. It's interesting, because as I participated in those discussions at Capitol Hill, there was another CISO that was very passionate about the software bill of materials, and I was thinking to myself, at my organization, how are we going to ingest that? How are we going to use it? Because if I've got the information, I better be actionable. So I was a little bit on the fence. I wasn't for or against it, but it was something other CISOs have been passionate about. Medical device manufacturers, I think both sides of the fence. They're a little bit nervous about putting the software bill of materials. And for those of you that don't know what the software bill of materials is it's basically a hardware and software. We call it the software bill of materials, but it's the software and hardware inventory of every component, whether it's software or hardware, within a medical device. And what that could do or can do for health systems or partners is really ingest that data and then provide threat information about, if there's an exploit. So let's say a medical device includes like Log4j, for example. Right now, a lot of health systems have no idea what sits on their connected medical devices in their environment. Now, there's a lot of great technologies out there. I know our partners from Assembly are here and do scanning of connected medical devices and provide great insight and data to that. But what would be even better is if the medical device manufacturers were really transparent about what's on there. Now, what I will say, the passion goes both ways on the CISO side. So there's a lot of CISOs that say there's no value in it because they just don't have the teams, they don't have the capacity from a skill set perspective to look at that data and really do anything with it. They're just not at that maturity level. However, there are other more mature security programs or security programs that have invested in that space that absolutely could ingest that data. If there's a vulnerability such as Log4j, they know how to respond to it, they know what devices, they know what remediation to do within their environments. On the medical device manufacturer side, what I'm hearing and seeing is medical device manufacturers definitely want it out there, but they're concerned that if they put that information out there, and let's say there's an exploit out there for something like Java, but their version of Java or their version of Windows doesn't have the services turned on that are vulnerable, it'll create chaos and confusion within the marketplace when there is a vulnerability. So I think they are having a hard time seeing, for probably about half of the provider space, them really being able to use that information and, it becoming a challenge for them. So that's kind of what I'm seeing around that. Some of the things that I think can happen with it, though, is I think, products that can ingest that technology, scan your environment, and partner together, I think we could get to a better maturity level, and that could be useful.
Great context, Troy. I mean, we're trying to improve patient care. That's our number one objective. So
Another question here. What strategies and technologies are you seeing most effective for medical device manufacturers to secure and protect the Internet of Medical Things?
Yeah, we've got a couple slides, and I haven't been really good about popping through these, but just a couple things that I kind of like to speak to. So if you're a medical device manufacturer and your health system, and it's not too bad to see, but and your device becomes vulnerable, what's the first thing that you have to do? So if we're looking at this chart, you've got a security vulnerability identified. That timeline is immediate. The vendor starts an investigation into the issue, starts to work on a patch. That patch must be developed, tested, and then deployed. That's a week minimum, and I think we all laugh at that. That's probably at least a month, right? And then as you kind of step down the cycle, the patch is received by the manufacturer, regression test is done, and that can take, really an unknown amount of time. And then the device vendor must coordinate, distribute to customers after full testing and some testing at customer sites. And then, you get down to level 5 or step number 5, and that's the finish line, right? We've got the device patched, it's secure. So what we're seeing is, what's happening on the left-hand side is you've got weeks and weeks or months and months of, effectively a device that's very vulnerable within your environment. One strategy that we're seeing is for IOMT to mitigate risk is in between steps 1 and 2, having something like at Fortinet, our FortiGate firewalls that are all powered by threat intelligence from our FortiGuard labs, having that in line, right? So I was talking about a medical device manufacturer in the laboratory space embedding our firewall technology right on those chassis, right? So what they do is they build a custom access control list. They enable IPS, which is receiving threat intelligence from our FortiGuard labs. FortiGuard labs within our organization, we have about 9 million firewalls doing threat scanning across the globe. So it's a really big footprint of data. But then we're able to issue a patch to protect those devices within either IPS. They could maybe do some configuration within their access control list and disable supports. And they can do this all from a centralized perspective and do this really within a day or two, right? You got to understand the threat, or maybe even hours. So, the issue on the left, or the situation on the left, is weeks and months. The situation on the right is, probably within hours or days, really reducing the amount of risk, within the environment. So what we've done is we put together, a few different use cases. The one that I talked about on the left is dedicated protection. Also, remote connectivity is important. I think as a CISO, I saw over the course of 5-6 years, at least 5 different remote access tools that were significantly vulnerable and exploited within our environment. They started to basically push malware from the vendor's environment over to ours. So we took that connectivity, very important for our organization, to really reduce that down, making sure that you're using best-in-class solutions there. And then also something that I would say is more on the frontier. So there's a lot of medical device manufacturers that are embedding EDR, so endpoint technology. So not just firewall technology, but endpoint technology as well. I'm a big advocate for really a layered approach to security. So I think when you're doing that and you're putting, more options in place, you're going to increase your ability, to do something more quickly. So maybe as you're going through, the slide that I just brought up here, you're going down the line on the left. Okay, the firewall solution, maybe not the best solution, but if I had endpoint on that solution, that might be a better option. Just a few other things that, I'll step through at Fortinet that we talk about and recommend for organizations. Maybe more on the provider space. So as we look at this slide, these are the 5 levels of NIST, security maturity, and the different protections related to medical device security that an organization could consider. Some of them, as we started level 1 on the left, are much more basic, things like segmentation, micro and macro segmentation, having a great inventory. So, our partners here, Simile, they can really give you a much more advanced inventory of the connected medical devices on your network, which then can integrate with our tools to provide those detections. As we go up the maturity scale, though, a couple that I'd like to mention are things like honeypotting technology. So honeypotting technology is really interesting. We create honeypots within our technology of fake connected medical devices. So we think of them as decoys. So if you've got a connected medical device, an MRI, a CT, we can really replicate that device, put a fake one out there within the environment. We all know these devices are hard-coded. They're hard-coded to the modality. From the modality, they're sending to the PAC system. And anytime an adversary or threat actor tries to access one of those devices and it's a decoy, we know it's a malicious attack, or maybe a misconfiguration on the network, which, maybe that's affecting radiologist performance as well. Maybe there's some type of misconfiguration in the environment. So that's one of the more advanced technologies as well. We also deploy that with, things like patient portals, physician portals, PACS portals, those types of things, just to replicate anything that we can, maybe a key asset within your environment that an adversary would attack. The area I'll end there, our SaaS-based providers are really big into this, because they're putting those decoys out there for their SaaS portals, for accessing those, so that they can get better threat intelligence, when someone's coming from an area that they don't typically support.
Yeah, we'll go to questions.
Yeah, so I appreciate everybody with the cameras and the paparazzi, but if we want to have a deeper conversation, pharma@fortinet.com, and we're happy to engage and go through a more specific deck with you and your team. But I'd love to open the floor to questions for Troy.
Just one slide that I brought up here. So one thing that we do with aggregating the data across, our millions of endpoints, millions of firewalls really across the globe, is break that data out into verticals and sub-verticals. So that data is pretty easy to see. But in this scenario here, this is based on a a geography perspective. And what's interesting about this is, depending upon the geopolitical things that are happening across the globe, it's really interesting to see where the threat actors are moving and how much more activity might be happening. We operate in most of the world, so that's kind of a slice of that. And then we can break it down more as well, breaking it down to maybe even a specific customer environment.
Well, that's it. Thank you, everybody, for coming out. Like I said, if you want to have a deeper conversation, farm@fortinet.com. Hope we close out the show strong, and there are a couple of envelopes filled with money in the front row.
Thank you.